Taoiseach, thousands of people are leaving the health insurance market on a monthly basis. We're now facing a situation where up to 6,000 people a month are cancelling their health insurance policies. By the end of 2013, in 2 years alone, we estimate about 140,000 people would have cancelled health insurance. And the bottom line, Taoiseach, is that government policies are driving people out of health insurance. And people can no longer afford, and families can no longer afford health insurance policies. And when I say government policies, Taoiseach, we only have to look back to the budget and the decision of the Minister for Finance to reduce significantly tax relief on health insurance policies, which had a very huge impact on many, many people. And of course, the Minister pretended that it was for gold-plated insurance policies, but we now know that that was an untruth. And in fact, it affected up to 80–90% of all policies. You have the additional 30 million bill that will flow from the decision to charge patients who are using, with health insurance, who are using public hospital beds. And that will lead to a significant increase. And today we had the announcement by the Minister, which we learned from the media, in terms of an increase of about 15% on stamp duty. And cumulatively, if you add it all up, Taoiseach, even in a short space of 2 months, the government is essentially increasing the average health insurance policy by about €400. And that's just average. In many cases, it will be more for others. And Taoiseach, I would pose the question to you, because you knew, and the government knew when it took its budget decisions in relation to health insurance, you knew this increase was coming down the road, that this increase was on the way in the context of risk equalisation. So you knew that when you decided to go heavy on reducing tax relief on insurance and in relation to the utilisation of public hospital beds. Was one increase not enough, Taoiseach? Wouldn't one increase have been enough, given all that's happening in the health insurance market? And why are you hammering hard-pressed families who are of the view that they're paying for everything anyway, without this additionality? Now, I would ask you, Taoiseach, will you change policy? And will you reverse your decision that you took in the budget in relation to tax relief and reducing tax relief in health insurance policies, and restore the tax relief to its pre-budget levels?
Thank you. Taoiseach.
It's never an easy position to have to draft budgets in an area like this, given the circumstances that we find ourselves in. Now, I detect from your question, Deputy Martin, that you yourself have changed policy here, and that it appears to me as if what you're advocating now is the abandoning of risk equalisation and community rating. And if that's what you're saying, well, then you're denying reality in that 20,000 people a year become 65.
Sorry, please.
The matter is that Deputy Martin seems to be implying here, Ceann Comhairle, that there should be a change of policy from government, which would abandon older people to be manipulated by health insurance companies because of the fact that they naturally might well have higher costs in terms of the medical requirements and the treatment that they need. The clear objective of the Minister for Health is to reform this health service, to deliver a single-tier health service. But to do so in a way that allows for older people to be charged the same rate for the same policy as people who are a lot younger, and that's the community rating delivered through risk equalisation. Now, if Deputy Martin's advocating a change in that, then let him say so. I think it's very clear. We shouldn't underestimate this. Every single year, 20,000 people more reach the age of 65. That's a 3.3% annual growth at Ceann Comhairle, compared with an overall growth of 0.5%. It's also interesting to note that in 2003, just 13% of those who had health insurance were over 60. That increased to 15.9% in 2009, and by 2012 this had risen to 19%. So it's a fact of life that our population is ageing, and if we are to retain and maintain, which we will do, community rating, and not have a situation where older people in our society would be manipulated by health insurance companies who would seek to present health plans which would effectively abandon the older population. We cannot and we won't do that. I'd make the point to Deputy Martin that even in these very straitened times, government still provide 400 million in support to policyholders through the tax system, and 400 million of a subsidy to the public bed system, because we don't charge for the full economic cost of beds in hospitals. So while these things are never easy, it is a fact that we must maintain and will maintain community rating and risk equalisation, so that the older people in our society are not abandoned.
Deputy Martin.
To ignore the question that I asked you, which is essentially, would you change policy in relation to the budget decision you took on reducing tax relief on health insurance and restore it to its pre-budget level? That is the question that I asked you. Because the point is, Taoiseach, the point is, I never said to abandon anything in relation to community rating. You just deliberately just threw that out there to try and distract and go down the cul-de-sac. It was a very dishonest presentation by you, but that's fair enough. We're used to that. But the bottom line, Taoiseach, if you are sincere in maintaining community rating, the hemorrhage cannot go on. And its government policies are driving the hemorrhage out of the system. That is the bottom line, Taoiseach. 64,000 in 2012 left health insurance. It's estimated that 75,000 will leave by the end of 2013. And do you honestly think that increasing fees via reducing tax relief and charging for public beds in terms of utilisation of public beds by health insurance holders, even though they pay their taxes, is that going to help community rating? Anybody who knows anything about the health insurance market are talking in terms of a death spiral, which essentially means when you take out younger, healthier policy holders from the system, you increase the burden on the older holders and make it untenable. And the centre will not hold, Taoiseach, if the hemorrhage of people from the health insurance market continues.
Thank you.
And in the meantime, for hard-pressed families, you're making life unbearable for them by this incoherent, ad hoc type of policy as it unfolds. I mean, the Minister said he didn't know that Minister Noonan was going to do what he did in the taxation side of the budget. And he wasn't consulted, he said, in relation to that. Now, he said that, which I think reveals the incoherence at the heart of government policy in relation to health and health insurance generally. So will you answer the question, Taoiseach, will you reverse the budget decision to reduce tax relief? By doing that, you would give much needed relief to people and give them some chance of holding on to their health insurance policies.
Taoiseach.
That's the second time you've quoted Gates in this House in the last fortnight. That's good, I think. The point is, Deputy Martin, that the newer insurers do not have the older people. Now, you can't have it every way. You can't have it every way. And newer insurers can't just expect to have younger people who naturally have less requirement for medical attention than older people. And I'm glad that you've now reversed again, because what you started off by asking was an implication of the abandonment of risk equalisation and community rating. And even in your own days, you still adhere to that. And that's something that we have to support, because we can't have a situation where older people are abandoned and whereby manipulation, insurance companies could present plans that were not suitable for older people. So community rating and risk equalisation is a very important part of this for older people, 20,000 of whom reach 65 and over.
Thank you.
But I do think, Deputy Martin, the consultative forum set up by the Minister for Health to deal with this will report now before Christmas. We'll bring it in here and talk about retaining young people and young families that are hard-pressed in so many ways within the health system, and also how the insurance companies themselves can reduce their costs. I mean, why is it in 2013 that we're still paying? Why is it that in 2013 we're still paying the same charge for procedures that used to take quite a long time and required days in hospital 20 years ago, but can now be done in a relatively short time? Like cataracts are now dealt with in 20 minutes. Why is it that the costs are still the same? What's going on here? Why is it that I hear so many stories coming to me every day from people who go through the health system? The charges in here seem to be very erratic, to put it mildly. So I think that there's a requirement on us all in here to debate and discuss the recommendations and the report of the consultative forum on this, which will be available now inside 4 to 5 weeks, I understand.
Thank you.
There's clearly, Deputy Martin, you recognise this. You're a former Minister for Health yourself. There is clearly a need to get down costs here. There's no extra money coming into the Exchequer as a result of this. This money stays in the pool, and extra credits are given to those people who are over the age of 65. And that's why it's very important to retain community rating and the risk equalisation system.
Deputy Adams, thank you.